Welcome to Chesapeake Healthcare. My name is Dr. Michael Lantz, and I'm the director of the Perinatal Center. We look forward to helping you have a safe and healthy pregnancy. This video will tell you about the options for genetic testing that will be offered to you early in your pregnancy. It's important to remember that this testing is completely optional and should be based on your own values, interests, and goals. You'll be offered at least 2 ultrasounds or sonograms during the pregnancy. The first genetic screening sonogram is offered between 11 and 14 weeks into the pregnancy. This looks for the fluid on the back of the baby's neck. This is known as a nuchal translucency, or NT. It screens for Down syndrome and certain birth defects. All babies will have some fluid on the back of their neck at this stage of the pregnancy. Usually a baby will have 46 chromosomes. Chromosomes carry our genes, or the genetic information that determines our eye color, hair color, and other characteristics. Babies with Down syndrome have an extra chromosome. This can cause certain health issues like heart problems and intellectual disabilities. The NT measurement can be combined with a blood test to determine the baby's chances of having Down syndrome. This test is called first trimester screening and can detect about 85% of babies with Down syndrome. This test also screens for trisomy 18, which is another less common genetic condition. The second ultrasound or sonogram is usually performed between 18 and 20 weeks into the pregnancy. At this ultrasound, we look at all the parts of the baby, or the anatomy of the baby, and check how the baby is growing. Some types of birth defects, which occur in 3 to 5% of all pregnancies, can be seen on this ultrasound. It is also possible to pick up some but not all genetic conditions. It's important to remember that a normal sonogram does not rule out the possibility that the baby may have a health concern.
Hi, my name is Debbie Lantz, and I'm the genetic counselor in the Perinatal Center. Non-invasive prenatal testing, also known as NIPT, is a blood test on the mother looking at circulating cell-free fetal DNA that is floating around in her blood. NIPT can be performed anytime after 10 weeks of pregnancy. This is primarily used to screen for Down syndrome, trisomy 18, and trisomy 13. The rate of detection is around 99% for Down syndrome, around 98% for trisomy 18, and over 90% for trisomy 13. This is a screening test only, and false positives and false negatives are possible. A false positive indicates that the baby has the condition when actually the baby does not. A false negative means the test is negative when the baby actually has the condition. Therefore, it is important that any positive result be followed up with genetic counseling to discuss the option of diagnostic testing. Most insurances are covering NIPT, but some differ in coverage, particularly in low-risk women. Please check with your insurance carrier regarding coverage. The office can provide you with the test codes for NIPT.
There are 2 diagnostic tests which involve collecting cells from the pregnancy to diagnose various genetic conditions in the baby. The results of these tests are over 99% accurate in telling us if the baby has the condition. Chorionic Villus sampling, or CVS, is performed between 11 and 13.5 weeks. Using the ultrasound for guidance, the doctor takes a sample of cells from the placenta. The risk of miscarriage from this test is about 1 in 150. Meaning 1 miscarriage is expected every 150 times the test is done. Amniocentesis is performed between 15 and 22 weeks. Using the ultrasound for guidance, the doctor inserts a needle into the mother's belly to get a sample of the amniotic fluid. Amniotic fluid is the water that surrounds the baby. It contains some of the baby's cells. The risk of miscarriage from this test is about 1 in 300.
Genetic carrier testing is an optional test people can do before or during pregnancy. This is a blood test that can tell you whether you have a higher or lower chance of having a baby with certain genetic conditions. These include cystic fibrosis, spinal muscular atrophy, and sickle cell disease. Most of the conditions we screen for are inherited in an autosomal recessive manner. This means that both parents have to carry a change in the same gene for the condition to occur. People who are carriers for a recessive condition usually don't have any related symptoms or health problems. If both parents are carriers, there is a 1 in 4 or 25% chance to have a baby with that condition. Prenatal diagnosis would be available to these families. Carrier screening cannot always pick up patients who are carriers. However, if you have a negative screening test, the chance of being a carrier is significantly reduced. The American College of Obstetricians and Gynecologists recommends that all pregnant patients be offered carrier screening for cystic fibrosis and spinal muscular atrophy. Cystic fibrosis is a condition that can cause lung and digestive problems. Around 1 in 25 to 1 in 100 people are carriers of cystic fibrosis. The chance of being a carrier depends on one's ethnic background. Spinal muscular atrophy, or SMA, is a disease that destroys the nerves controlling voluntary movement. About 1 in 35 to 1 in 117 people are carriers of SMA.
We understand this is quite a lot of information. Please ask your midwife or doctor to help you understand this testing so you can make an informed decision. We are also available in the Perinatal Center to help answer any questions you may have.